So here we have our tray set up for polishing. We have our patient bib. We have our cotton pliers, which is going to be used to help pick up and move things. We have our explorer. So this is our explorer end. The other end here is our periodontal probe, which is used to measure pocket depth and bone loss. The only people who are going to be able to use this end is going to be the dentist or a hygienist. We also have our intraoral mouth mirror. And we have here our air water syringe tip. Other items you're going to see on your tray are going to be your prophy cup or your prophy angle. That's going to be used to actually place your polish in it in this corner here. Here we have our prophy paste. There are a bunch of different brands, a bunch of different flavors, kinds, different strengths of grit that you may see. Here, this is optional. This is a ring that you can place on your finger to hold your prophy paste in. We have 2x2 gauze, floss. We also have two kinds of suctions here. This one here is our saliva ejector. This one here is our HVE, which is a high volume evacuator. You are also going to have your handpiece, whichever you or your office use. In this instance, this is our hygiene handpiece here, or you may see a slow speed motor with a straight attachment.
You're using a disposable prophy angle and a hygiene motor, or you can even use a regular slow speed motor with a straight attachment. When inserting your prophy angle into the hygiene motor, you'll find the dot and the open slot on the prophy angle, and that will slide in until it locks in place. If you're using a slow speed motor with a straight attachment when putting your prophy angle on, you're going to find the same divot in the attachment with the open part of the prophy angle. Slide it in until that divot meets up, and then you're going to twist the motor to lock on. So you have either option to use a different type of motor when polishing. You want to make sure you have your overhead light over top of the patient, because you're using that to shine in their mouth so that you can see directly in the light. If you have no light, that's harder visualization for you. So you want to put it directly above them, high enough so your head isn't hitting it. With your prophy paste, you can have it on a ring on your finger or just holding it. You want to put some prophy paste inside the cup, and then you want to have the patient turn towards you. And the prophy angle is the only part going in the patient's mouth. The motor part is not. So you want to take that, have the patient turn towards you, and smear the prophy paste on 3 to 4 teeth. You don't want to start the motor until it's in the patient's mouth to avoid splatter. So don't press the rheostat and start this until it's in the patient's mouth, and you start it slowly. And you're going to swipe the distal, the direct, and then the mesial. Distal, direct, mesial. Distal, direct, mesial. And as you can see, I'm rotating this in the mouth as I'm going to kind of engage with the tooth. You don't want to put too much pressure on the prophy angle and the tooth, or stay on the tooth too long, because you can heat up the tooth and damage the nerve. So you want to spend 1 to 3 seconds per tooth, and enough pressure that the prophy cup flares out slightly. So 3 intermittent swipes per tooth, and you're just going to follow all the way along. If you need more prophy paste, you go back in, smear it on the teeth. I personally like to do 1 quadrant. And again, I can rotate it by this. I'm always having a fulcrum. A fulcrum is very important with the pen grasp, because it gives you stability so you don't slip and hit the patient. So after I do the first quadrant, I will have the patient turn. If they need any suction, I sometimes let the patient hold the suction, or I also use the suction to help retract the teeth. So I've done this quadrant, so now I'm going to come to this quadrant. I've gotten some prophy paste. I'm using my suction to help me retract. I have my fulcrum, my pen grasp. The prophy angle is the only part going in. I'm smearing the paste on a few teeth, starting the motor when I'm in there, distal, direct, mesial, distal, direct, mesial, distal, direct, mesial. So light intermittent swipes on the teeth. You want to be sure and rinse the patient after you either do an arch or a quadrant, because it can be kind of gritty and they might not like it. Close down, open. When polishing the linguals of the teeth, I use my mirror to retract. I'm gonna have the patient turn away from me. Again, I have my pen grasp with my fulcrum. I've smeared it on a few teeth. I'm gonna start it in the patient's mouth, and I'm just distal, direct, mesial, distal, direct, mesial. Intermittent swipes covering the whole part of the tooth, and I'm not staying on the tooth too long. Now when doing the anterior linguals, you don't want to be breaking your neck to look in. So you want to use your mirror with your overhead light for indirect light. My overhead light is now hitting my mirror and bouncing up so I can see her linguals. So again, I have my fulcrum, my pen grasp, and I'm using my mirror to see the lingual of her teeth. I start the machine and it's the same. Light intermittent swipe to cover the tooth. I'm not staying on the tooth more than 1 to 3 seconds. And then I would have the patient turn and keep going.